Yeah.
And I'm gonna set up our live, and then we can start in a minute.
Just let me know when.
We'll do. And then for people who just joined in, we're gonna start in a minute. I think some of you were sent a link, and that just signed you in under my name. If you care at all, if you want to rename yourself, just to let you know. If not, it's totally.
We call everybody.
Everyone's obvious today. Yeah.
Yeah, I know. Right. Small group. Just sort of. No, even as long as everybody's vaccinated. Yes. I'm going to mention that. I actually have it in there. So I'm just going to you just right here. Oh, it's not through here now. Yeah, I think so. I'm coming back.
Okay. Looks like we already have a question. So just in terms of the questions, I'll monitor both Facebook and Zoom, and I'll read them aloud towards the end, so you guys can go through the presentation, and then we'll do that. But I'm about to start the live, and so I'm going to get us started. Okay, perfect. So hi everyone, thank you all for joining us either on Zoom or tuning in on Facebook for our Workshop Wednesday series. Today we are focusing on the COVID-19 vaccine. It's coming at a great time as more and more vaccines are being administrated and more people are having questions about the vaccine. And so we're really grateful to have two people here that can kind of walk us through it and really cater it to the Arab community specifically as well. So with that, I'm just going to kind of hand it off, and just on behalf of PAC, thank you all for joining us. Ramadan Kareem to everyone who celebrates. Thank you all for joining us and being here, even if you might be fasting and it's been a long day, but this is a really important conversation. So we're happy to be providing this for the community. I'm going to hand it off. We're joined by two doctors from the Arab American Medical Association, Dr. Khalid Badr and Dr. Samir Tamous, who are going to lead us in this conversation and introduce themselves and the work that they do.
Good evening, everyone. Ramadan Kareem. My name is Khalid Badr. I'm a pharmacist. Next to me is Samir Tamous, also a pharmacist. Before we move on, just a little, let me just put, can everybody see my slide? Okay. Do I need to just scroll down? No. Do I need to do this? No, you're good. You can do it that way. Okay. Just a disclosure. I am a pharmacy owner and operator. I do not have any financial interest with any of those vaccine companies. Same thing with Samir. Yep. He's an independent pharmacy owner. No financial interest with any of the COVID vaccine companies. Want to make sure we get that out of the way. Before we talk about the vaccines, I want to spend just a minute to talk about the virus itself to help us understand the importance of the vaccine. So COVID-19 is an infectious disease that caused by a new discovered coronavirus, and it spreads through the droplets or saliva through the nose. That's why using a mask cover, a face mask cover, is so important of reducing the transmission of the virus. And we need to also understand the symptoms of COVID. They range anywhere between mild to severe. Mild symptoms include fevers, chills, cough, difficulty of breathing, fatigue, muscle aches. They mimic the symptoms of the flu. So sometimes people cannot differentiate between that and and the COVID vaccine, COVID disease and the flu virus. And the only way to tell the difference is through a COVID-19 test. Usually, the typical symptoms of the COVID appear 2 to 14 days after exposure to COVID-19. And again, they range between mild to severe. And I'll go in details about the severe symptoms. Severe symptoms include difficulty of breathing, pain or pressure in the chest, difficulty of waking up or difficulty of going to sleep, skin color changes, pale, gray or blue colored skin. That requires an immediate medical care. So either contacting your doctor, calling 911, or going to the nearest hospital. Let me see here.
Now, you're talking about the side effects for the vaccines, or
no, I get
COVID. Okay, sorry.
So, like I said before, it's sometimes difficult to differentiate between COVID-19, if you're infected with COVID-19 or the flu. So the only way to really differentiate is to do a COVID-19 test. There's two different types of tests out there: antibody test and a swab test. The antibody test, it's not a diagnostic tool. It just tells you if you were infected with COVID-19 before. And that utilizes a blood sample. The swab test, which utilizes a nasal swab, it is a diagnostic tool. It tells you tells the patient or healthcare provider if the patient has COVID infection in the body present.
So with the testing and also COVID-19 and the flu, if you're ever in doubt, always go get tested. I mean, testings are free. Even if you have insurance, it doesn't cost you anything. With the antibody testing, like Khalid mentioned, the accuracy is not there unless you do the serology test. If you do the saliva antigen test, usually the rule of thumb is two negative. If you get a negative test twice positive, then chances are you are positive. The PCR, the nasal swab, is really the gold standard for COVID testing in the U.S. here and maybe worldwide as well.
People who should get tested: people with symptoms of COVID, people come in contact with somebody with a confirmed case of COVID. Close contact is within 6 feet for more than 15 minutes. I apologize because we're still at the pharmacy. So we're seeing patients. And sometimes we get a little bit distracted from. Okay, so give me 1 second. Can everybody hear me? I'm not sure. Can you?
Yes, I hear you.
Yeah, okay. Okay, all right. Okay. So we're done with this one.
Down. Here we go.
Okay, so best way to protect yourself, let me go back to the other one, is obviously wearing a mask, social distancing, avoiding crowds if possible, hygiene, washing your hands for at least 20 seconds, vaccine. I have that bolded. We're going to focus on that in the later slides. And being informed. I also have that in bold. There's a lot of myths and misinformation on the internet. Be well informed from the right sources. That's talking to your healthcare worker, visiting sites like cdc.gov or the WHO. Those are sites that you can visit to get actual information. Just be careful for that with misinformation on the web. anything to add, Mr. Thomas?
No, I mean, I know many people go to Google and maybe some people on Facebook and social media sharing stories and pictures. You know, many people have ill will, and maybe they just want to cause havoc and, you know, amongst us. So please go to a trusted source. Like Khalid mentioned, the CDC is definitely one of the trusted sources. News media, as well as the FDA. Just keep in mind that whatever we say right now, 5 minutes later might be obsolete and something new comes out and kind of wipes out everything that we've learned and everything we thought. And you know, with the COVID, it's new to us, and the healthcare industry is just trying to cope with it and trying to catch up with the changes and keep everyone informed. So again, like Khalid mentioned, just go to a trusted source and rely on that.
Okay, so now we're going to talk about the vaccines. Okay, so as of today, there's 3 vaccines been authorized in the United States, and they're not FDA approved, but they are authorized. The study's been done on those vaccines and looked at by the FDA. So they give them the authorization to administer to distribute the vaccine. So far there's 3 companies: Pfizer, Moderna, and Johnson & Johnson. Pfizer requires two shots. They have to be 21 days apart, and that's the only one that could be used for patients 16 and older. Moderna is also 2 shots, 28 days apart. That's only for patients 18 and over. Johnson & Johnson, it's only 1 shot, and that's for patients 18 and older. We will focus at the end of this presentation about Johnson & Johnson. That's the one that's in the news, so we'll talk about that in more detail. Okay, so as of April 12th, over 189 million people, 180 million doses been administered in the United States. As of today, I think it's over 192 million. So millions of people gotten the vaccine. So the benefit of getting the vaccine is really to reduce the spread of COVID-19. It keeps you from getting seriously ill or going to the hospital. It helps to protect the people that are around you, fathers and mothers, senior citizens, really protect the community. And the most important thing, really ending the pandemic. I mean, we need to reach herd immunity, and only way to reach that, or one of the best way to reach that really, is through vaccinations.
So just to touch on what Khalid just mentioned right now, I mean, many younger adults, they say, I'm healthy, I have no health issues, I don't want to get the vaccine. And to that we say, you know, it's not only about you, it's also about the people you come in contact with. So like Khalid mentioned, you know, parents, elderly, older family members, or even younger people with other illnesses or health conditions that might be affected. So, you know, it's not just about me or them, it's about all of us. I mean, we're all in this together, and we all have to be together to basically help put this under control, or maybe eradicate it or end it altogether if possible.
So talking about the side effects of the vaccine. No, one more forward. Sorry.
Oh,
there's no back.
Backwards.
Okay, sorry.
Here we go.
Right. So side effects of the vaccines: pain, redness, and swelling at the injection site. That's common with all 3 vaccines. So these side effects are common with all 3 of the vaccines that we just listed. Pain, redness, and swelling. Also, you'll feel with the injection site that it's usually at the upper arm. You feel the arm getting heavy, and throughout the body you will feel tiredness, headache, muscle pain, chills, fever, nausea. Younger patients, we notice, are experiencing more of the side effects than older patients. And they believe the reason is because younger patients have a stronger immune system, so their response is stronger. and that's why they feel more of the side effects. None of these side effects really anything to worry about. They do not recommend taking anything before getting vaccinated. They do, however, recommend keeping Tylenol handy after getting vaccinated. That could be used for the fever, for the muscle pain, muscle aches, for the headache. You should use Tylenol. And also highly recommend using vitamin C and zinc while you're getting vaccinated or before you're getting vaccinated. It really helps your immune system stay strong. And for the side effects, Samir and I've been vaccinated with Moderna. Samir was vaccinated with Johnson & Johnson.
Yes, sir.
And we did experience those side effects. I did not experience fever.
I did.
Okay. Everybody's different. So you some people that I've known personally who got vaccinated could not move out of bed for 24 hours. But the second day becomes better. The third day really came back to normal 100%.
So just to touch on the side effects, I mean, yes, everything that Khalid mentioned, I pretty much experienced except nausea. And honestly, I mean, Tylenol, all I needed is Tylenol, just 2 tablets in the morning, 2 tablets at night, and I was able to cope with the fatigue and the pain and the fever. So it's nothing, the side effects were not debilitating where I couldn't just, work. I mean, I was working, I was vaccinating. The only thing is I had to take my Tylenol. That was my best friend for the 2 days after I took the vaccine. All right.
Okay. So side effects. How to report side effects? We encourage everyone who gets vaccinated to report the side effects. 3 ways to report the side effects. Obviously, healthcare professional. Your best source in that case is the pharmacist, or the person who actually gave you the vaccine, or your primary doctor. Another way is you could do it online through the vaccine adverse event reporting system, and that's open to everyone: patients, caregivers, healthcare providers, anyone that has anything to report about a vaccine could utilize the system. Also, they have now what they call D-Safe, which is a smartphone tool that uses text messaging and web service. So it's actually the web survey. It's once you fill out the survey, it customizes the answer according to what you fill out. So it's really a good tool to utilize. It's not a tool to use if you have an emergency side effect or a reaction to the vaccine. For that, you need to contact your primary doctor, call 911, or visit your nearest hospital. But this is how they track a lot of the side effects with the vaccines. It's really good information to have as healthcare providers and for patients. Mr. Samir, you want anything about the reporting?
So reporting, I mean, people think that you can only report side effects that is not listed, and it's usually encouraged to report all side effects, even if you experience fever, fatigue. The common side effects, please do report them, because that's how the CDC, the FDA keeps track of how many people experienced it post-marketing, and that's how they can also evaluate the safety of the vaccine. So please report any side effects that you experience.
And even if the side effect doesn't make sense, report it anyway. That's their job. You sort out what, if it's vaccine related or non-vaccine related. Okay, so talk about more about the side effects of the vaccine. The anaphylaxis after getting the vaccine, it really happens 2 to 5 people per million, which is very, very rare. Okay. Another question we also get is, can COVID-19 cause death? I researched a lot of the information out there, and according to the reporting system, out of all the reports that you received, only 0.00, I believe 1.00185% were we reported as death may be related to the vaccine. But once they looked into these cases, they found no evidence that the vaccine contributes to the patient's death. So as of today, no vaccine was contributed to any deaths in the United States. Any thoughts on that? Or
no, again, it's just going back to what we talked about. Just report everything and let the CDC and the FDA look into it and find out what's the cause of the event. And that's really their job to decide. And like Khaled mentioned, there were some family members reported death, and when it was investigated, there was no evidence to support it. And again, it shows it was reported, and they kind of commented that it's not related to the vaccine.
But they have to keep records of everything that's reported. So even though they report it, it doesn't necessarily mean has anything to do with the vaccine, but you just have to keep records of it. Okay, so moving on to the safety and efficacy of the vaccine. Is the COVID-19 vaccine safe? I forgot the word vaccine up there, but so okay, if it's approved by the FDA, I trust the FDA because in order to be approved by the FDA, the drug or the vaccine has to go to a rigorous process for safety, effectiveness, and quality control. So, yes, the vaccine is safe, and it reduced the number of patients being hospitalized to zero. It reduced the number of people dying from the virus after getting vaccinated to zero. So the drug is safe and it's effective because we just said it reduced the number of patients going to the hospital. It reduced the number of patients dying from COVID-19. Can we trust the COVID-19 vaccine? Yes. And the recent incident that happened with Johnson & Johnson, it's really a testament to the FDA that 6 people out of, I believe it was close to 7 million at the time, had some platelet disorders. And they halted Johnson & Johnson vaccine. It's because they really monitor everything. And anything that may be suspicious or may be serious, they don't, they take it very seriously and they take a look into it. And the reason it wasn't the Johnson & Johnson vaccine was not recalled. It was put on hold because they wanted to do more monitoring, wanted to make sure that it is safe and it's not vaccine related. Another question we get is, which vaccine should I take? And the best answer is the first one that's available to you. So if it's Moderna, if it's Pfizer, if Johnson & Johnson comes back to the market, and then it will be Johnson & Johnson. Again, I have family members who took Johnson & Johnson. The only reason I took Moderna because that was the first one available to me. So I did not pick and choose which one I wanted to take. I literally took whatever was available. Okay. And another question, a lot of people have a hard time finding the vaccine. It is not available everywhere because there is a shortage. So you can utilize vaccinefinder.org. You put in your zip code and it tells you which pharmacies have it or which locations have the vaccine. You can also ask your local pharmacies. Or they usually are getting a weekly supply of the vaccine. And state health departments, local news, and the VA hospitals also have information on the vaccine. Any questions so far before I move on from how to find a vaccine or anything we talked about before?
There are some questions in the chat. Do you want me to get to them now, or do you want to do it at the end?
Maybe we should take them now,
Yeah.
and we'll go back just so we answer everyone's questions.
Yes.
Sorry.
No worries. Sounds good. Okay. So I'm going to just start in the order that we're getting. So if you got the first shot and you get the various between the two shots, how long do you need to wait till you get the second shot?
What was the question?
I think they're just asking how long to wait in between your shots.
Well, it depends which shot we're talking about.
No, she's saying.
Oh no,
that
I understand their question now. They're saying if you got the first shot and then you got COVID, how long do you wait before getting the second one?
3 months.
3 months.
Well,
Okay.
So
the answer
so now with the 3 months, I mean, now there's more studies showing if the patient who gets the virus gets antibodies or remdesivir, then you should wait 3 months. And this is now, I'm just talking specifically about the Johnson vaccine. You have to wait 3 months. If you had COVID and you did not need to like antibodies or any infusions or remdesivir, then it's 2 weeks and then you're able to get the vaccine. So I'm not sure about Pfizer personally, but I just wanted to clarify that.
The patient was on Pfizer or
Moderna
Moderna.
or Pfizer because they got one. Yeah.
From my understanding, it's 3 months. I would get back to you on that one specifically. I would definitely call the Pfizer and I will ask them to make sure. I did not find any information on that when I was researching, but I'll call Pfizer and I will ask them because that is an interesting case. You shouldn't. Are they sure they were? I guess the patient is not there, so.
Yeah, I mean, I know one physician who received the first dose and then he like a week later he tested positive, and I believe he received the Pfizer vaccine. To my knowledge, 3 weeks later he took the normal dose. But again, with this one, I'm not really sure.
Yeah. I will get back to you on this one, but that is a good question. So if you were tested positive of COVID a month ago, when should you take the vaccine or start taking the vaccine? The recommendation is 90 days. Okay, because if you already got tested positive with COVID, the theory is your body already has antibodies against the virus that would last for a minimum of 3 months, or at least for 3 months. So they don't want to overwhelm the immune system at the same time. So they said the recommendation. It doesn't mean that you can't get it before. It's not a contraindication, but the recommendation is to get it after 3 months.
And there's on the CDC, there's also some information showing that you can take the vaccine 6 weeks apart as well. I'm talking about Moderna and Pfizer. There's some, but they're saying there isn't really extensive studies about it. Also, I'm sure we've heard in the Middle East there are some countries that's actually spacing the vaccines even longer period of time apart, more than 4 or 5 weeks.
But the best route to take is the recommendation, which is 21 days and 28 days apart. 3 weeks, which 21 days is for Pfizer, and Moderna is 28 days.
28 days, yeah. Yeah.
Oh, good. Thank you for that. The next question, there are two, but they're related, is what is your advice to older people who don't want to take the shot, and how can we protect older people from the side effects of it?
Okay, so the only advice I can give to older people is take the shot. I mean, I know everyone is very concerned about the risk, but we know that for elderly, especially if they have other healthcare conditions, God forbid, especially diabetes, if they test positive or if they get the virus, their survival becomes very slim. So I know most people are concerned about the side effects, but we know that COVID-19 virus, biggest side effect is death, and just take the vaccine.
It really prevents a lot of complications. Like Samir said, it prevents them from going to the hospital, from getting seriously ill. And I'm sure all of us know somebody who heard a story about somebody getting the COVID, being in the hospital. It's not a sight you want to see. Not able to speak to your loved ones while they're in the hospital. It's really heartbreaking. The stories that we hear, the patient that we see, it's really, really heartbreaking. I don't know about Samir, but sometimes I really do take a long drive after work, just to kind of bring my brain down a little bit, because all the things that we see and hear, it's really mind-boggling. So people really need to take it seriously. Really, the vaccine is something that we utilize, for a long time. I know this is new, but this is really something that could help literally save patients' lives. and have them talk to a trusted healthcare professional that usually helps with the seniors.
Okay, to answer the second question about their side effects, honestly, Tylenol and just bed rest, that's really the best thing that we can do after they take the vaccine. And patients should be, aware that they should have like a day or 2 days off if possible, not necessarily, just to kind of rest. So you might not want to schedule the vaccine accordingly, keeping that in mind. I tell patients all the time, make sure when you try to schedule it where you're off for the next day, or on Friday where you're off on the weekend, whichever way fits their schedule. So that way they're not, they can just relax for the next 2 days.
Thank you for that. And thanks for all the work that you all and other healthcare workers have been doing just year round. A big shout out to all of you for taking care of people in our communities. The next question is going back to COVID, I think specifically of when do you think infected people should go to the hospital and why? Like, I guess at one point, should people go to the hospital if they have COVID? And what are the most important steps that people should get from pharmacies to protect their families from the virus?
Okay. One, people should go to the hospital. Okay, when they are experiencing the symptoms. So if you know you have COVID and you're not experiencing anything, or you're experiencing mild symptoms, self-monitor, definitely let your doctor know. Difficulty breathing is a major sign that you need to go to the hospital or contact your doctor. Chest pain or feeling heaviness on the chest, that's also another sign. Or noticing any color changes from the lips, usually if lips turn blue, or facial, or the skin turns gray. That's also a sign that patient's not getting enough oxygen and should really report to the hospital. What you should get from the pharmacy, the oximeter, it's a good tool to have. It's a meter that fits on the finger, and it reads your oxygen level. That's really a great tool to have to make sure that you get enough oxygen. If it is less than 100, if it keeps coming back to 95, 96, that's a sign you're not getting enough oxygen. It's usually 99, 100, what the oxygen level should be. Mr. Tamus?
Yeah. So with the pulse ox, the one that we sell in the pharmacies, I mean, there is, again, it's not FDA approved, but I mean, it meets the good manufacturing practices standards and certain requirements. So with that, I mean, I would say 97, 96, you're fine. Like I had mentioned, the biggest signs are basically shortness of breath, constant coughing, and chest pain or leg pain, because leg pain might be a clot forming, a deep vein thrombosis. So when you get that, that's a sign that you need medical follow-up. We always tell our patients when they test, if they test positive, please contact your physician, let your doctor know, and just keep in contact with your physician. Many patients, especially in our Arabic community, they're willing to take it the extra mile. They stay home even if they're tired, the shortness of breath. They're saying it's going to get better tomorrow. It's going to get better tonight. Do not wait, because every second counts. So the sooner the better, especially if you do not feel well. And everyone knows their selves better and their body best. So once you feel that you can take it, don't exaggerate and just seek medical assistance ASAP.
With strokes, literally seconds matter. That's the difference between somebody being brain dead or dead or staying alive. Seconds matter. So if you notice something, rather be on the safe side, report it. Seek help. Like I mentioned earlier, the symptoms of the COVID and the flu really kind of are similar. Let the healthcare professional determine which one it is. If you're not sure, let the doctor determine it. If they have the tools and the know-how to differentiate the difference between a regular flu or strep throat or COVID-19. So you have to be proactive in your health. We have to be proactive in our seniors' health. So if you have a father or mother living alone, please make sure you don't have to go. If you're not fully vaccinated and they're not fully vaccinated, just call them, make sure they're okay. And the benefit of getting fully vaccinated, you can, after being fully vaccinated, you can visit a loved one, or you can be inside a gathered place as long as everyone in that place is fully vaccinated. When I say fully vaccinated, it doesn't mean after you get your second shot, for example, let's say you took Pfizer vaccine, after you take your second shot, you're not fully vaccinated until 2 weeks after that second shot. So your body still has to build up the immune system against that virus, and that usually takes about 2 weeks. So you consider fully vaccinated 2 weeks after that last shot. So with Johnson & Johnson, for example, it's only one shot. It's 2 weeks after that one shot. With Moderna and Pfizer, it's 2 weeks after that second shot. And to go back to that question, what should you get from the pharmacy? Like we said again before, Tylenol. That's really a big help. Tylenol, zinc, and vitamin C. We say that all the time. So it's really something that you should have at home.
Thank you for that. The next question is, when do you think your pharmacy will have the vaccine, or either of your pharmacies?
Well, we have, okay, so I have 5 pharmacies. 4 of them have the Johnson & Johnson. 1 of them has the Moderna. So, and it's in the sake. I will give you my contact information afterwards. I don't want to solicit any patients or any business doing this. I will give you the information, and you can pass it out to anybody that would like to make an appointment to get the Moderna injection.
Which is, you can go on the website, Pharmacy Plus, and then there's a registration queue in there, and from there you can choose the best time that suits you based on the pharmacist's availability, and everything is done on the website and electronically transmitted, and the appointment is booked. So it's really straightforward process. And
I'm willing to work with PAC, maybe if you guys want to, I guess, do a vaccine day, okay, that we could come and vaccinate, have an appointment list, and we could come in and Samir and I will come and vaccinate X amount of patients. So we could definitely set that up.
Yeah, I'll be in touch about that. Actually, that could be very helpful. Cool. Thank you. So then we have 2 questions from the same person. I think you already touched on this, but if I have antibodies, would you recommend taking the vaccine? And then what is your recommendation for people who are pregnant and or breastfeeding in terms of the vaccine?
Okay. So for the antibodies, again, recommendation is 90 days after if you tested positive with COVID to get vaccinated. Testing for antibodies, you really have to know the antibody load in order to know if you're well protected or not. It's still recommended to be vaccinated even if you have the COVID, if you got infected with COVID, but they recommend waiting 90 days.
So just regarding the antibodies, I mean, again, it's what we disagree on doesn't mean that, we're against each other. It's just different schools of thought. So even if somebody has the antibodies, because right now we do not know for how long the antibodies last in our system. Initially, they were saying 6 months. Then there's some studies came back and showed 3 months. So regardless, I would say 2 weeks after exposure, if you did not take any antibodies, any plasma, remdesivir, go ahead and get the vaccination.
No, but they're saying, I'm sorry, I apologize. Yeah. I think you misunderstood. They're saying patient was infected, has antibodies. Right. The CDC recommendation is 3 months after that. They're not just getting contact with somebody. They already know that they're infected, and right. Did I get that question correctly?
Yeah, and I think there's also some data on the CDC that's showing 2 weeks.
Yeah.
So that's why I'm saying, I mean, it's kind of conflicting, but most of it saying 2 weeks and you're good to go. And I know in the past we were saying 90 days. I'm not sure which one is the most accurate, but within that time frame, 2 weeks to 12 weeks, you should definitely get the vaccine. Do not wait more than that.
for pregnancy, there is no active studies regarding pregnancy. However, they are confident that it is safe in pregnancy because they are utilizing it as we speak. So CDC recommendation is healthcare provider needs to make that decision, the risk versus benefit ratio. So does it benefit the patient or not? Which means really, does the patient have any underlying diseases or anything in their lives that may require them to be vaccinated that would be more beneficial for the patient than not getting vaccinated. So for that, really, it's really case by case scenario. So it depends on the patient. Is there anything else going on with the patient at that time? So so the recommendation is they need to refer back to the primary, and the primary really needs to determine if it's beneficial. It's not a contraindication to get vaccinated if the patient is pregnant.
So the American College of Obstetrician and Gynecologists, they do recommend it for pregnancy, as long as, for whoever of age or eligible to be vaccinated if they're pregnant. Again, what we say right now, that might change in the near future. Biggest example is Johnson & Johnson vaccine. It's approved, we're vaccinating, and all of a sudden we get an email Wednesday morning saying, do not vaccinate, hold on until we get clarification because of the side effects that 6 people experienced. So again, to Khalid's point, please check with your OBGYN, with your doctor, if you're pregnant or planning on getting pregnant.
And another question I was getting is, does the vaccine affect female fertilization? Can she get pregnant in the future if she wants to? There's no evidence that suggests vaccine affects male or female of the production system, correct? Sterility of patients. So we get questions like, I don't want to get the vaccine because I want to have a baby in the future. There's no evidence that suggests that affects anything that sort. So please, again, refer to your healthcare provider for actual information. And actually, that was one of the questions listed on the facts and myths under the CDC. Apparently, they're also getting a lot of questions on the same issue. But yeah, it does not affect the person trying to get pregnant or trying to make a family as of now. No one really knows, but they're very confident that it does not affect anything. It does not affect pregnancy. Really, only time will tell. But the mechanism of action of the vaccine, it does not suggest it interferes with reproductive system. I agree.
Yeah, I think that's very important to know. Thank you. The next question is, if you go to the hospital, so I'm assuming they mean if you have COVID and you go to the hospital and go under the ventilator machine, how long should you stay under the ventilator machine and why?
I cannot answer that. Yeah. That's for a physician to, an ICU or a CCU physician to decide, and I'm sure it all depends on the patient condition. So unfortunately, that's out of the scope of our practice.
Yeah,
sorry.
Really, it's determined by, again, patient by patient. Some patients require ventilation for a couple of hours, a couple of days. Some people require more. It's really tough to answer, not knowing all the facts about the patient, but really it's for the physician to determine that.
Yeah, definitely. The next and last question that I have so far, goes back to the Johnson & Johnson vaccine. So what are your thoughts on the Johnson & Johnson vaccine and the new developments with the blood clots?
I give my 2 thoughts and then Samir will give it. He's vaccinated with the Johnson & Johnson vaccine. I believe the Johnson & Johnson vaccine will come back to the market after the look into the 6 cases. I need to emphasize 6 cases out of millions, out of 7 million at least. Yeah. So we have, everything we do, it has side effects. Everything we do, it has risk. So it's very rare. Even if that causes a vaccine, it's still very, very, very rare. A lot of medications that we use today that are FDA approved, we use every single day. Some of them do cause death in some patients, whether an allergic reaction, they're contraindicated to the medication, and unfortunately, people sometimes the medication doesn't agree with them. But the FDA is just trying to be very, very careful because everybody's on edge, and you want to make sure you look at every single side effect that comes their way. So they're just being very, very cautious. But I believe it will come back because millions of people took it, and a lot of them, a lot of people are fine. They're not, again, 6 people out of 7 million. I just need to emphasize that. I know I keep repeating that number, but it's just a very small number.
It is a small number, and I do agree with Khalid. I mean, the benefit definitely outweighs the risk, and hopefully in the next 2 days, we should hear back from the CDC, the FDA, with the okay to start vaccinating. And once we get that, I highly encourage everyone to go and get it. It doesn't matter which vaccine you get, just please go and get vaccinated.
We literally, I'm just not telling patients that. I literally am telling my parents, my loved ones, I literally tell them to get vaccinated, and even me, I'm having a hard time get some people to convince some people to get vaccinated. But really, my parents, I got them vaccinated. Very close that I get them vaccinated. That's really my biggest testament. Is really I'm an advocate of vaccines. It helped save many lives before, and this is no different. The Spanish flu, same thing. Many diseases, between that and then, now we use vaccines to really make our lives better, and this is really just no different. People have concerns because
that's not side effects of Pfizer.
Yeah. This is the lack of water from Ramadan. I just want to check, but stop it. People should get vaccinated. I mean, vaccines really, really save lives. People are worried because they came up with the vaccine in such a short period. This pandemic was it hit everybody. So what the United States government did, they really, really spent billions of dollars on this vaccine. They took actions that they never took before. So these threw a lot of money and resources to the healthcare workers to come up with these vaccines. So what normally took 5 years to enroll 30,000 patients for the study, it literally took them weeks to come up with these 30,000 patients. So they saved a lot of time. Plus the money that they spent on research helped a lot. So I understand why people have concerns because they come up with so quickly, but they gave them a lot of resources to use. That's why the vaccine was developed quickly. But no shortcuts were taken. FDA does not care about shortcuts. Does not care about what's going on. They want to make sure their job is safety and effectiveness. The drug has to be safe and effective in order for it to be authorized or approved.
No, nothing to add.
Yeah, agreed. Thank
Sorry
you.
about my voice. It's just really dry, and I know it's.
No, we're all on the same page. Those are all the questions so far that I had in both chats. So I don't know if you have closing remarks or things you want to close us off with, or if anyone has any last minute questions, this is your time to kind of ask it. But those are all the questions.
I would definitely. Yeah, when I give you my information, and you can share with anybody that's listening. I'll share my information and submit the information. If anyone has whether maybe a question they're trying to ask, or they think of a question later, or our doors are open. Whether you are a patient or not our patient, our doors are open. You can come in and ask a question and leave. So we're here literally for the community. So if you just have a question for us, you could call us, you could come in, whatever we could help, we would help. So, and I'm sure I'll speak for Samir as well.
Absolutely.
Thank you. Really appreciate that. And I want to also encourage everyone to, if you're confused or you don't know where to get a vaccine or language is a barrier, please call PAC and we can also help you do it. We're translating some flyers into Arabic too to get more information around. So if anyone has any concerns or just needs help even with the registration process, please call us and we can definitely do that.
And CDC, by the way, CDC has a lot of information. All the information is also in Arabic and so many other languages. So it's any language you speak, they have it. So because they want to make sure everybody gets the right information.
So if you Google pre-vaccination questionnaire in Arabic, the CDC form will come out, and it has the pre-vaccination questionnaires. And then the information of it, there's about 3 or 4 pages about the vaccine, and it's all in Arabic and in layman language, so it's easier for people to understand.
And if you utilize us for resources, we could definitely help them. I know many seniors, whether they don't have access to the internet or they don't know how to, we would definitely help them. So I'm sure you guys do too. So.
Yeah, definitely really appreciate that. I don't see any other questions or comments popping up. So I want to thank you both on behalf of PAC for taking the time to share this with us and to really advocate for our communities and just for all the work that you've been doing, I'm sure year round, especially given the virus. So thank you both for joining us. If you have any closing remarks or last minute things, the floor is yours.
No, thank you so much. Ramadan Kareem.
And vaccine. Get the vaccine.
Ramadan Kareem and vaccine.
Make sure you get the vaccine.
Yes, definitely. Thank you both.
Thank you guys.
Thank you.
Bye.
Take care now.
Bye.